Hey guys, welcome back or welcome home. I had a request to talk about fertility, pregnancy, and then labor induction. Fertility is not a specialty of mine. It's not something that I treat. I always refer that out actually to people who specialize in that. So I'm not really in a position to talk about that. But I have treated a lot of pregnancy, labor induction, those two. So I'm at least willing to speak to some degree about sort of the sort of what I know about it a little bit. But I'll keep it kind of general because it's not, it gets pretty granular pretty fast. So I'll try to keep it pretty general here. So let's see. Okay, the first thing is that pregnancy itself actually is, remember last time we talked about the 5 cycles. We talked about 5 elements as it applies to your life, from birth to death, and each part of the, wood pertaining to adolescence, and fire pertaining to early adulthood, and then earth adulthood, really, the fullness of adulthood, and then metal is kind of middle age, and then water is kind of old age. Go back and listen. But I had said in the beginning of that there's actually 3 cycles that sort of 5 element theory sort of recognizes, and pregnancy is one of them. So the pregnancy itself occurs along the lines of 5 phase, 5 element theory, also beginning with wood. It's considered a yin cycle because it pertains to the physical growth of the baby. So it's a yin cycle. So it starts with wood. So one thing of note here is that anyone who's had kids will have done the confusing math of that they talk about the 40 weeks of pregnancy or the 9 months of pregnancy, but then 9 months times 4 is only 36 weeks. So then you have to remember there's those extra days tacked on for the sun calendar, right? Even though we use months. So here you would have been using a lunar calendar, and so it would have been the 40 weeks or the 10 lunar months of pregnancy. So that divides into 5 quite nicely. So what you get is 2 months, 2 lunar months of per element, starting with wood. So the first 2 lunar months of the pregnancy are embodied by the wood element. And then it moves on into fire, and then like this, right? So there are some ideas about which comes first, gallbladder or liver in the wood case, but I'm not sure that it matters all that much, especially because people seem to argue about it a little bit. I've gotten different opinions about this, and I always feel like if it really mattered, then the truth would be out. You know what I mean? Like if the human body was really, if the universe really needed that rule, because like if that rule really mattered, then it would be more obvious, if that makes sense. It would be sort of there. So the fact that we're not sure tells me it's probably not that big a deal. But the notion of it really is this thing about more a general Chinese cultural idea about how do we increase the jing of a baby. You want your baby to be born with as much jing as possible, meaning as much potential as possible. And so there were these ideas based in Chinese medicine about how you might do this to increase the jing of the child, right? So we talk about the health of the mother going into the pregnancy, the health of the father going into the pregnancy. They even talk about time and place. Well, I haven't talked about this in a while. So, like at conception, basically 4 factors come together to affect the jing: the health of the mother, which is called the red; the health of the father, which is called the white, generally younger being better, and this, in general physical health and all that. But then equal in that situation is time. So the time of year that the child is conceived. And there was not really a differentiation made between sort of intercourse and conception. There wasn't this notion that there was this few days of lag time. It was considered to be the same timing. And so maybe it's like inception and conception or something. I don't know. But anyways, so what you had was these notions that you wanted to try to basically time your intercourse around certain things. In this case specifically, it was more admonitions against not trying to conceive or have intercourse at times that were too extreme. So this was things like the winter solstice or the summer solstice, where the days are the longest or the days are the shortest and the nights are the longest. These are considered extreme times, and that it could affect the jing of the child, meaning that it could be good or bad. So it could give the child very strong jing, but it could also give the child very weak jing. But the Chinese are sort of the middle path people in that sense, so they better not to take a chance, just go in the middle. So that few days surrounding those times, it might be better to just kind of take it easy. So these would be sort of things around this question of time issues, but you even get things like questions of planetary alignments and certain constellation alignments and stuff. I mean, you do see this. Remember when we had the Black Dragon year a while back, and a lot of Asian families were trying to conceive children so that the timing of the birth actually would fall into this Black Dragon year. But the old school way to do it, the pre-modern way, wasn't just to think about the birth, but also the conception. Okay, so then the fourth thing that happens at conception that affects the child's jing is then place. And they would say that I'm trying to remember. They would say that you should try to conceive a child in a place where plants grow easily, indicating that there's abundant earth chi in that area, and that this abundant earth chi then will support the mother during the pregnancy and support her spleen, which will be under pressure during the pregnancy. And so you want to take a more sort of sort of more for pragmatic view of it. It's that there would be a lot of food to eat, right? Plants grow easily, so but this is what they say. So these four factors then come together and affect the child's jing at that moment of conception, right? But then now the woman is pregnant, and so then the entire pregnancy also affects the child's jing. And we could of course argue like, maybe this is even more important. So these questions, what's interesting about that is, it would be my inclination, my impulse to say, yes, the 10 lunar months of pregnancy would seem to be far more important in terms of affecting the child's jing than, something like just this moment in time of conception. But what's funny about it is that this is where the father's input happens, is at conception, and where it ends, really, and in terms of in a physical sense. And we know, sort of from a Western standpoint, that the male's contribution can be quite strong, right? You talk about autism rates for older fathers and these kinds of things. The older the father is, the worse the health outcomes tend to be for the child. And this is measurable, right? To the point that Western medicine actually, would say it. And so that's interesting that that's measurable, and that in Chinese medicine, it's considered that time and place are of equal importance in this situation to the man's contribution. And that was their notion of it. But we don't study time particularly. We don't study place particularly. I mean, we do, but not really, right? So, anyways, interesting, curious. So anyways, woman is pregnant now. So the first stage of the pregnancy is the wood phase, and this goes on for 2 lunar months. So it'd be nice if somebody made an app for calculating this out. Then during the 2 lunar months, in this case wood, then you want to do your treatments will follow the wood sort of ideology, which is sort of strengthening liver blood, making sure that the liver is relaxed, right? But a lot of this is just strengthening the liver as much as possible. And they also say not to over-sedate whatever lunar month you're in, whichever element you're in. Don't over-sedate that one, because that energy is trying to come in. Now, of course, we're not saying that the liver is being made at that time, and then then the heart comes and there's no heart before that. It's not how that works. This is a more subtle thing, because they actually will say to use the appropriate outer shoe points at that time. So for the wood phase of the pregnancy, you would use the outer shoes of the liver. So that's an indication to me that this is something having to do more with something more related to the Shen. Something, so this more subtle effect to some degree, right? And then so this goes on through. They'll say things like in the wood phase or in any phase, they should eat food that relates to that phase. So for the liver, more leafy greens, or more meat of a certain type that affects the liver. Whatever your belief is around which meats go to which organs, this kind of thinking, building up the liver blood more, right? And then so on and so on and so forth. What else? Things like, you should listen to wood type music. So old Chinese theory has all these ideas about, chord structures and note intervals and these kinds of things that would dictate, instrumentation and stuff that would dictate what kind of element is being, affected at that time, depends on the music, right? So you put that into a modern context, like what kind of music do we listen to in the modern context that strikes you as more woody versus music that's more fiery, right? I mean, even within genres, if you're a jazz fan, like what would you consider fiery type jazz versus more woody or watery? I don't know. These questions start to arise that are interesting to me. They even have meditations, like during the wood phase, women should, go up to a high place and look down upon a scene so that you can kind of see a landscape, kind of see far into the distance, and then relax your eyes and just stare into this distance, stare into this landscape view. And it's the sense of allowing the liver to relax. The liver relaxes when it has a sense of perspective. And vice versa, that a person is relatively healthy in their liver when in all situations they can keep perspective, right? Because that's the general's job, is to look into the future and say, okay, here's how we get from point A to point C. B is in the middle. That's perspective, to look into the future, right? And we lose perspective when we're fighting with our partner. We lose perspective on what matters sometimes. You know what I mean? So this liver. So anyway, these are these different things that they have. I always thought it would be neat if somebody came up with a product around this. It'd be kind of fun. A little box, a birth box, and somebody could open it. Okay. So that's this notion of what constitutes sort of this 5-element cycle around pregnancy. Okay. And it mostly has to do with this notion of, things you can do to increase the health of the child during the pregnancy, to increase the amount of jing, to increase their physical and mental health when they're born as much as possible. That's what this is in a lot of ways really about. Okay. All right. So this is a very general way of looking at things. I think it's kind of fun, Okay. So then you can get more sort of specific about this. And, there's a couple of things to sort of think about here, I think. The first one is that there are these sort of rules that apply in pregnancy. For example, things like, I said it before, the spleen will be under a lot of pressure during the pregnancy. I think in the Western sense, the blood volume like doubles, the woman's blood volume like doubles during the pregnancy. I think it is something wild, right? But you have to remember, where does this extra volume of blood come from? It doesn't magically come from the kidneys. It doesn't magically come from the liver, from a Chinese medicine perspective. It comes from the spleen, doesn't it? It comes from digestion. Maybe in the next episode of this thing, we'll talk about what constitutes blood deficiency, how I think about that. But you have to think about it, that the blood comes from the spleen. So the spleen is under a lot of pressure, because then all of the structures around the baby, the placenta, the amniotic fluid, the cord, all of that is coming from the liver blood. The liver blood is what's supplying the means for the building of those tissues. And the spleen supports the liver blood directly. And so this relationship, all of that. So when the amniotic fluid is low, for example, this is a liver blood issue. Okay. When you get things like breech presentation, most typically breech presentation really is sourced in liver blood deficiency. The tissue around the baby, the musculature and the tissue around the baby is tight. It's not flexible, Remember we talked about before kind of my view on what blood deficiency is in an integrative sense. This sense, or liver stagnation is in this integrative sense, that it's related to blood deficiency and liver stagnation. You get a lot of tightness of the tissues, right? And so the tightness of that tissue around the baby makes it so that the baby has a hard time turning. So even when they go in there and do a manual eversion, the baby often just flips right back into their spot. It's like it's like the mold or something. They just flip right back into their little mold because that tissue is so tight around them. So you can prevent, for example, breech presentation by keeping the spleen strong. Okay, so rules of pregnancy. Spleen is under a lot of pressure. Okay. The liver blood is under a lot of pressure because all of the structures around the baby are coming from the liver blood. The kidney yin is under pressure because the baby itself, the actual physical baby itself, is coming from the kidney yin. Okay? And so it's the kidney yin of the mother that actually grows the baby. And so this is an interesting notion that there is this difference between the baby itself and the structures around the baby in terms of how we think about this kind of stuff. Okay, what else is there? So these are basic rules. Of course. So then, given that this is the case, that the liver blood and ultimately the liver yin is under pressure, given that the kidney yin is also under pressure and the spleen is under pressure, it's very common to see yin deficiency build during the pregnancy. So keeping those fluids strong, keeping the spleen strong, prevents that heat from happening later in the pregnancy. Because that rising heat later in the pregnancy, that's things like a preeclampsia, right? So this heat later in the pregnancy is a problem. It's not just a medical problem. I mean, it's just wildly uncomfortable, apparently. So this is what pregnant moms are always saying. At the end of getting towards the latter part of the pregnancy, if they're running hot, that just makes everything worse. I mean, they're just they're just uncomfortable when they're hot like that. So you really want to watch for that and sort of treat. Ideally, if a mom's going to be coming in, I would love to see them once a week throughout the entire pregnancy, because these are the kinds of things that I'm thinking about. And this is what I say to the patient. I'm like, hey, look, my recommendation is you just come in every week for the rest of this pregnancy, because these are the things we can prevent. But if not, you need to watch for this. If you start running hot at any point, hot flashes, just generally running hot in some uncomfortable way. Also sleep. So you need to tell them what the yin deficiency type sleep symptoms are so that they can look for that stuff. And if they start to experience that at any point during the pregnancy, I strongly encourage them to come in so we can get on top of that, because that will prevent birth complications later for sure. Okay. Another thing that I tell moms to look for during the pregnancy is water retention. So, you start getting that water retention in the ankles and it starts moving up the legs and stuff like that. If they start getting that water retention during the pregnancy, I want them to come in so we can get on top of that. Because for us, that's an indication of that kind of spleen/kidney deficiency, more on the qi and yang side. So I want to know about that. So look, if you're not going to come in to see me every week through the pregnancy, you got to watch for this fluid buildup. We can get on top of that very nicely. My old teacher would use, he would start with corn silk tea. If you've ever had it, it's quite tasty. But it's a very mild diuretic. It doesn't affect the kidney yin in any way. And it's tasty, and it's something that they can take over time. And on top of the treatment, it'll really get rid of a lot of that fluid. So you're supplementing the spleen. They're also taking this very mild diuretic that tends to help. The other thing that I'm telling the pregnant moms to look for is just energy levels. So this goes again with this kidney and spleen qi and yang, right? If they start feeling tired a lot, of course, a certain amount of tiredness towards the latter part of the pregnancy is understandable. But at the same time, we want to stay on top of that. Why? Number one, that is just not fun. Number two, they need to build up that energy for the birth. By keeping their energy strong going into the birth, they'll have enough energy to maintain strong contractions through the whole birth, all the way till the placenta is out. Because that's a whole other problem, is getting the placenta out, right? So keeping all of that, that's how you keep so this is keeping their energy strong during the pregnancy, then is a way to prevent birth complications later. So these are the things that I'm telling pregnant moms to look for during the pregnancy. If these things start to happen at all, come in and see me. And then I tell them because it prevents things from happening later, especially during the birth, right? Okay. So this is my general setup around sort of the notions around sort of this general thing around pregnancy. These are sort of the rules of pregnancy and sort of how I talk to pregnant women. Let me run through some notes that I have, and other stuff is going to come up because I always forget what I'm talking about when I'm talking about them. So other stuff will come up, but there are some notions about what do we say? Sort of forbidden points. So let's sort of draw this out a little bit. This notion of forbidden points and kind of how this occurs. My teacher had the good fortune to train under a Korean practitioner who was like an old school Korean practitioner, had cut his teeth in Korea, sort of a barefoot doctor-ish kind of vibe. And they actually, in this Korean tradition, they had the notion that there was actually no such thing as forbidden points. Let me start this conversation by saying that I am not advocating that anyone go out and use forbidden points or in any way break their local laws, but I'm just saying that there are these notions out here that there's no such thing as forbidden points, and they had this idea that it was just a matter of doing the wrong treatment that went against the principles of Chinese medicine. What do we mean here? Like spleen 6, right? Classic. What's funny about spleen 6 is if I asked you to tell me what's the number one point that you want to use in pregnancy, if you could, you would probably think to yourself like, well, gosh, spleen 6, it supplements the spleen, it supplements the liver, it supplements the kidney, it regulates the relationship between these very important, yin organs, especially around pregnancy, kind of the three most important organs around pregnancy. It's amazing that spleen 6 is suddenly this no-go, right? Because it would strike you as the perfect point, right? It really, I think, well, not I think, sorry. It really, trying to claim credit for something. The Korean, this particular Korean tradition had the notion that it really depended on how you used the point. This is what would dictate whether it was a usable point or not. So in the case of spleen 6, this Korean tradition said that it was okay to supplement spleen 6. And generally the way they were doing it was through needle direction. So needling in the direction of the flow of the channel was considered supplementing spleen 6. And that what you were doing in this case is that you were pushing qi, blood, and yin towards the uterus, kind of where you want it to go, right? So what the admonition was here in this Korean tradition was that you didn't necessarily want to just, in a cavalier way, sedate spleen 6, because sedating spleen 6 pulls qi and blood away from the uterus. You remember, I think it was in the second episode we talked about using spleen 6 to get rid of menstrual cramps. Well, in a sense, what you're doing there is qi and or blood is stuck in the uterus. So then you sedate spleen 6 using heavy stimulus, moving it against the current of the channel, the direction of the channel. Then by sedating it, you were kind of pushing the qi and blood out, getting it to move. All right, so this was their notion of it. And so then in pregnancy, you don't necessarily just want to do that because the baby needs that qi, blood, and yin. So it just kind of went against the principles of what the baby needs to sedate spleen 6. This wasn't the right way forward. But even with that warning in mind, there were cases where they would in fact sedate spleen 6 during a pregnancy if they thought it was necessary. The one place where I saw this done with my own eyes, the sedation of spleen 6 during the pregnancy, was in morning sickness. So in the earlier part of the pregnancy, the one time in the pregnancy where you would think to yourself like, well, that's when you don't do it, right? Because if the liver qi moves, they could lose the baby, right? I think we talked about this in a previous thing. Now I'm getting to the point where I don't remember what I've talked about. So bear with me if I'm repeating myself. But you have to remember that PMS occurs because the woman's body is naturally stagnating. Why is it naturally stagnating? Because it's preparing for pregnancy. The woman's liver qi stagnates naturally in order that the fetus will stay inside once she's pregnant. Because if the liver qi were to move, what would happen? Miscarriage. She would lose the baby. So we always put miscarriage, we say, oh, that's a kidney yang deficiency. That's a kidney yin, or a kidney deficiency symptom, generally kind of almost like a jing deficiency symptom. And that's correct. You just have to remember that it's the kidneys that are supplying the liver with the strength to hold. So it's the kidneys are the source, but the liver is the mechanism by which that fetus will stay inside. Right? So then if you were to be overly sedating the liver, sort of relaxing the liver too much, or moving qi and blood out of the uterus or something, then in theory this would increase the likelihood of miscarriage, right? And certainly in a patient, I mean, think about it this way. If you had a patient come in who had a history of multiple miscarriages, and there's this deficiency that underlies all of this, I mean, at the end of the day, the last thing you would think to do is sedate spleen 6 in that situation. It just wouldn't occur to you to do it. You know, it just wouldn't fit the pathology. You'd be like, well, let's supplement spleen 6. Again, I'm not saying that you should do it. I'm just saying that there are theories out there that sort of argue around this issue. Okay, that's what I'm saying. Okay, so then this notion of sedating spleen 6, when have I seen it done? I've seen it done in morning sickness. And because they say that in the early part of the pregnancy, there's kind of there's 3 causes of morning sickness in pregnancy. 2 of them are very common. And the first one is liver qi stagnation. So I just said the liver qi is stagnating in the early part of the pregnancy to hold the baby in. And that liver qi stagnation is sort of like PMS. If the woman has any pre-existing liver qi stagnation, now you've got double qi stagnation. Well, where is it going to go? It could go to the stomach. So this is a very, very common cause of morning sickness. Now, the thing is that women aren't really seeking care for this type because it tends to be fairly mild, and then it goes away by the end of the first trimester. But it's still worth treating. You know, am I sedating spleen 6 in this situation? No, I'm abiding by the local laws that I live under. But in this notion, this Korean notion, it can be done where actually sedating spleen 6 actually helps to regulate that relationship between the liver and the spleen and stomach. So sedating spleen 6 kind of sedates the liver to get it to back off of the spleen. So that's when they would use it in this situation, right? Okay. Spleen 6. Second most common cause of morning sickness in pregnant mothers would be spleen deficiency. So just straight up spleen deficiency. Remember, I said the spleen is under pressure. So if she comes to the table with any pre-existing spleen deficiency, then that spleen deficiency, the stomach could start going up, you know, especially in the presence of this liver stagnation. So those would be the two kind of most common causes there. My teacher would always say that you could almost kind of diagnose it by looking at or by giving them instructions. Okay, you have morning sickness. I want you to drink some lemonade and see if that helps you feel better. And if not, then drink some miso soup with some nice ginger in it and see if that helps you. If one or the other helps, then you kind of got your diagnosis there, right? Okay. These are the 2 most common causes of morning sickness, generally with pregnant women, but it's the least. Those 2 are the least common thing you're going to see in your clinic. The third type of morning sickness is the one that you're going to see the most in your clinic, which is this sort of stomach yin deficiency type of morning sickness. This is the one. This is the severe one. This is the one that the women are coming in and they're throwing up all day. Not just in the morning, all day sickness. They are, you know, everything's a problem. Dry heaves, you know, they've got nothing in there. They're still throwing up. I mean, this is the one that ultimately, in theory, can land a woman in the hospital needing fluids, nutrients, because they can't keep anything down. You know, even water's a problem. You know, they're living on crackers. So first of all, the way that you know, so the question becomes, okay, well, how do I know which of the types it is? Well, in a sense, the first way that you know it's the stomach yin deficiency type morning sickness is that they're here. You know, it's like severe, right? So second thing you can do is have a look at the tongue. Very often in these situations, the tongue will be kind of, red and sort of dry, maybe without a coat. If you're lucky, this would be a tip off. Another tip off would be smell sensitivity. So that heat in the stomach creates this kind of smell sensitivity where the woman is just anything, even bad smells, even good smells smell bad, and then they cause more nausea, right? So like that. Is there anything else that I'm missing? Oh, with the stomach yin deficiency type, it will, if this is a second or third pregnancy, whatever, then they'll have had it the last pregnancy and it was quite bad, and now it's worse, which is often why they're coming to see you, because it's like, oof, I don't want to do that again. Because another way it's a stomach yin deficiency type is that it extends beyond the first trimester. So most of your morning sicknesses end around the end of the first trimester, and then hitting the second trimester, they sort of hit what they call the honeymoon phase of the pregnancy. But often these types don't get a honeymoon because the nausea just continues, right? So, so anyways, there's reasons why you hit the honeymoon. But anyways, so these are the kind of things that let you know that this is probably the stomach yin deficiency type. Oh, you know what? Another good indicator that it's a stomach yin deficiency type is that your acupuncture does nothing. That's a really good tip off that this is because the other two types are pretty easy to treat. But this type, you treat them and they come back next week and they'll say something like, it helped for an hour. And then after that, it just kind of came back. So in my experience, and I've talked to a couple of other practitioners who have told me the same, acupuncture does nothing and is useless and pointless in this situation. I know some of you are screaming at me. But this is my experience. Okay, I don't know. So what does work quite well here is herbs. Of course, the difficulty of getting the herbs in and keeping them down, notwithstanding, herbs work quite well in this situation. And this is the thing that I look for, actually, for any of my moms that are planning to get pregnant. This is almost like a fertility question, but it's like, I'll have a look at their tongue and I'll see if there's any pre-existing stomach yin deficiency. Was there, sort of appetite issues, blah, blah, blah. But then I'll ask, how was your previous pregnancy and stuff. And if I suspect that there was stomach yin deficiency in the previous pregnancy, I'm going to hit them with the yin tonics, with the stomach yin tonics on before they get pregnant again to try to prevent it. Okay. So herbs work really well here. Mai Mendang. Sort of any formula with Mai Mendang in it, Mai Mendang Tang, typically tends to work quite well. If the formula with these mixed herbs in it doesn't work well, you could try just Mai Mendang by itself, because it's easier to drink, it's easier to swallow without the other herbs, because Mai Mendang, it's like thin and syrupy and light. So, and whatever dose they can get, just get it. Like literally, I'll have moms that's like, I can do like a quarter of a tiny scoop. They're like getting a quarter of a gram of granule or something. Okay, cool. Just keep at it. As much as they can get in, just get it done and just keep at it. If they can get those herbs in, keep them down and get on with it, it will help. It's a little amount. It may take a bit and they don't see it but you gotta keep them. You what you gotta do here? You got to really sell them on this. This is where your inner sales person comes out. You're going home with a vacuum, girl. You got to sell them this idea that the herbs will help, because it is hard for them to keep up with it. Number one, when it's difficult. Number two, they're already having a hard time and they're doing this weird thing. On top of that, they don't want to do anything. Right? So you really got to sell them on the idea that the herbs will help. And I really like to keep up with them. So I keep a kind of a tight rein on them. I'm checking in with them a lot. Hey, taking your herbs. How's it going? You having trouble? How can I help? And really strategize with them how to get the herbs in. Because it's hard for them to do, but if they stick with it, it always helps. Okay. So that's the most common kind that I see. There are other formulas. There's a ton of things. Once you have this idea in your mind, you can start poking around and looking. There's herbs out there, Tai Tzu Shen, and people are using Jupi Juru Tang and stuff modified. There's different formulas out there for this. Mai Mendang Tang was the one I was sort of taught. But anything with Mai Mendang in it, good to go. It's going to help. Okay. All right. So this is morning sickness. What are we talking about now? Let's see. let's see. Let me just roll through my memory banks here. Things, for example, like women who are trying to get pregnant, they say something like women shouldn't try to get pregnant again until they feel as good as they did before their previous pregnancy. I know. But that's what they say. Okay. So they say actually say to wait at least 10 months, which is, kind of the average time it takes for menstruation to reoccur. But the interesting thing that they say here is that when the menstruation reoccurs, starts up again around 9, 10 months, whatever, it's the sign that the woman has enough excess now, the mother has enough excess that the menstruation can begin again. Right? I mean, how many times have you guys treated like 22-year-old triathletes with amenorrhea? Because they have no excess. They're using all of their available blood and yang for training, for rebuilding muscles, keeping their joints healthy. It's so common, right? So so once they get their period back, it's an indication. Okay, now there's enough excess, so it's like they're kind of in a sense healthy enough, at least in theory, to go back and have a child. I mean, lots of women will get their menstruation back and still just be as tired as all get out. I know what it is, so don't yell at me. I'm just saying. But this is the idea, right? Okay. So that's one thing. Don't get pregnant again. What else is there? Things like towards the end of the pregnancy, they say that the last few months of the pregnancy, women should actually avoid sex because sex tends to raise the chi, and that's sort of the wrong direction for the baby. Now, the thing is that the real thing that they end up saying in this situation is that women should only engage in sex where orgasm occurs, because orgasm causes the liver chi to move. Right, so the liver chi moves, and then all that pent up yang moves through the system into the channels, and that's what feels good in a sense about the orgasm. But the source of that is in this sense, the liver chi is moving. We could have a separate talk about the maybe it's time that we had the sex talk. But this is a whole separate kind of conversation. But so if a woman has sex that does not result in orgasm, then the chi and yang are going to have a tendency to rise and stay up. And that's not ideal for the end of the pregnancy because the baby is trying to shift downwards sort of slowly. So, but if you have an orgasm, then the chi sort of moves and it regulates itself, so you don't get so much of that upward movement. But they still say, even with some of the textbooks will say like, nah, it's just better to avoid sex at the end. But then you start getting into late pregnancies where there's no labor happening, then actually sex is good in that situation. But the key here is the orgasm. That's what matters here. So if you're we're talking about induction, then and they talk about sex, well, you have to, there has to be that orgasm, or don't do it in a way. Okay, so what else? We'll talk about induction in a minute. Let me just get through everything here. What else are we talking about? Sorry. There's a point that I really like to use for premature labor. Speaking of labor, premature labor, if a woman starts to have not just Braxton Hicks, but more regular contractions, a good point to stop those contractions is spleen 4. But you have to do really strong stimulation at spleen 4. It's not fun, but it works. I've done this many, many, many times and stopped contractions, 35, 36, 37 weeks, and trying to push it out a little bit more. Try to get to that 40. Strong stimulation at spleen 4 works really, 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 really well. Okay. Let's see. You get things like women start getting things like round ligament pain. from the stretching of the abdomen there. Moxa, indirect or direct moxa, right over that area can be very useful. Varicose veins, those varicosities are an indication of spleen deficiency, so you give spleen tonics. It's sort of that notion of the spleen not holding blood along with that excess. Like that. Let's see. My teacher had the notion that a lot of the orthopedics issues that you see during pregnancy are actually more due to damp, in a sense, or at least dampness. No, I shouldn't say it that way. Dampness is a major factor and needs to be cleared. So in that sense, no matter where you're seeing pain, moxa can be very useful. You know, especially in palpation, it's not so hard to palpate dampness, especially if you knew her before. Right, and you can tell that the flesh is just a little bit more full of fluids than it was. Moxa, along with whatever treatment you're giving, is very useful because they actually say moxa disperses that local dampness. Okay. Let's see. Kidney 9. What's that? What do we call that point? The beautiful baby point or something like that. Kidney 9, they say, pushes kidney yin to the uterus. So kidney 9 is really useful anytime you're seeing yin deficiency, sort of gynecological issues that have kidney yin deficiency associated with the pathology. Kidney 9 is really useful because it very specifically, very directly pushes kidney yin towards the uterus. This is the traditional notion of it. And so in that case, then just using it as a matter of course, sort of pushing kidney yin toward the baby. And so the more kidney yin the baby has, the more beautiful it will be. I think that's kind of sweet. And it's a nice little thing to tell the patient while you're treating them and stuff. It's fun, Speaking of yin in general, you kind of come back to this question of, what are good yin tonics, for the mother to take? And it tends to be these kind of mild things like mai mendang, tai zi shen, goji, these kinds of herbs. They're mild yin tonics. And so these are good things that the mother can drink throughout the pregnancy. Get some raw, and boil it up and make a tea or something like that. And they can have just this little tea, or somebody should make a product for this. But just have them drink it as a mild tea through the whole pregnancy, and just keeps that kidney yin up, or just keeps the general qi and blood, keeps the fluids up. Let's say it that way. Okay. You have things like, you know what that does? That actually, sorry, this is so disjointed, is you have those yin tonics will actually help to prevent herpes outbreaks. During pregnancy. Generally, any kind of herpes outbreak tends to be sort of, it usually is sourced in this kind of yin deficiency. You also see this with herpes around the lips and stuff like that. It always starts in situations where the person is like overly tired, overly stressed, and a little dry and hot, and then that thing really comes out. Now, of course, the local lesion is itself damp heat, but you can prevent that from happening by, these like genital herpes and that kind of stuff. You can prevent that from happening by keeping the yin up, through your acupuncture, through your herbs. And so any woman that has, for example, has genital herpes and they don't want to get it, then during the birth, it's a problem. So you can actually do some work to prevent that by keeping their yin up. Okay. So this is sort of the notion of it. As far as, so the last question, probably forgetting things, but the last question here that I received on this was around labor induction. So we just talked about that. From this perspective, from the perspective of kind of what we've been talking about, what you're supposed to do, and this is agreed upon by pretty much everybody who talks about this, is that you're kind of supposed to use contraindicated points, and I would add that you should use them in a contraindicated manner. So you're supposed to sedate spleen 6, to soften and ripen the pelvic floor and all that, ripen the cervix, soften the pelvic floor, all that stuff. You just relax all those muscles around there, right? So sedate spleen 6. They say you should supplement or tonify large intestine 4. The reason that you don't want to supplement large intestine 4 during the pregnancy is that supplementing large intestine 4, they say it draws qi and blood out from the center and moves it out into the periphery to make it available to the person to use, because the yang ming is this organ that's full of qi and blood, right? So it's just constantly full of qi and blood. So by supplementing Li4 in anybody, it makes more, it pulls it out from the center and moves it out into the periphery. But in the pregnancy, as we saw with spleen 6, that's not what you want to do, right? So actually during the pregnancy, they say something like sedating large intestine 4 is okay, as it pushes qi and blood back to the interior. So this is what they say. So in this case, you'd actually supplement large intestine 4 for labor induction, or even for like stalled labor and that kind of thing. Strong stimulus at gallbladder 21, up there on the shoulders. This is the strong stimulus at gallbladder 21. This is actually well documented that it does soften the pelvic floor, relaxes the muscles around the uterus, which especially in the early part of the pregnancy is contraindicated generally. So, but now this is where you want to do this. And then all of these things should, in a sense, you should start to use these to some degree probably about 4 weeks before the pregnancy. So before the birth, sorry. So in those 3-4 weeks beforehand, you really want to regulate liver, soften the liver, because the liver now has to relax in order that the womb can kind of open and relax. Remember the conversation from the first part of the pregnancy. So regulating the liver is kind of the name of the game here, and again, keeping the qi up. But then as you get closer to the due date, then you can be a little stronger in your use of sedation of spleen 6, supplementing of large intestine 11, use of gallbladder 21. And then you get into those kinds of points that you use sort of right when, because a lot of the times the women are coming in and they're already at week 41 and saying like, if I don't give birth soon, the midwife's going to, send me out, or the hospital's going to induce or something. I'm trying not to do this. They don't give you much time for the lead in, because more ideally you would have multiple weeks to kind of soften up, treat them a couple times a week. Now it's like, all right, I got to see you every day, and this is where you can really hit these points pretty hard. And that's where you start pulling out the UB32, and so you start hitting UB32 with the E-stim. There's a couple of master tongue points that I really like here. Of course, Lingu Dabai is one that they use for induction. They actually, this is where these points are for use when the woman would like to go into labor now. So then now these points are kind of useful, but not in the lead up, not in the weeks leading up. There's another one, Huobai, and this one is HUOBAO. It's 55.01 for you tongue heads. And this point is used. It's on the plantar surface on the bottom of the second toe, in the sort of in the center of the sort of distal joint crease there, and you use that point. They actually do recommend some palpation, as there's a bit of a discrepancy as to where this point is exactly located. So you can do a bit of palpation and see if you can find an Asher point right in that sort of general area, and needle that both sides. And this is said to be quite strong, and I've had pretty good luck with it. So Lingu Dabai, you guys know where that is, and Huo Bao. So remember bao like envelope. So this kind of opens the envelope. It's very useful as well for like menstrual issues and the like, but contraindicated in all other parts of the pregnancy. Remember. Okay, so this is kind of the deal. Pregnancy stuff, induction. Might as well say it since we're here. Once you hit the childbirth, of course, so stalled labor and stuff, these points are also useful. Retained placenta, these things are very useful. Again, all these points are very useful for that. They say the retained placenta is sort of an indicator of the qi deficiency. There's not that strong contraction. A lot of times that qi deficiency leads to like the baby getting stuck in the birth canal, where the contractions aren't quite as efficient at pushing the baby out. So you really need to keep those contractions up and strong. But a lot of the times, by the time the baby's in the birth canal, the mom's already wiped. You know what I mean? They've been overnight labor and all that, and they came into this tired. Hopefully not, since they're your patient. Then this can be a problem. So So, but again, then you need to kind of push them over the hump. You can use these contraindicated points in a sort of contraindicated manner, and that often will just give that last push to get them out. So, like that, childbirth. There are a number of postpartum questions, but I don't know. Seems like enough, huh? Good? Yeah? Okay. You guys take it easy. I love you all, and let's talk soon. Okay, bye.